Your dog pulls their head away the second they see the toothbrush coming. You've tried holding their jaw, tried the flavored toothpaste, tried doing it fast before they notice. Some nights you just skip it, because wrestling a dog for 30 seconds of brushing isn't worth what it does to both of you. You're probably not alone in this either. Maybe you've told yourself you'll try again tomorrow, or that a dental chew here and there probably covers it. Most dog owners are in the exact same boat, brush a few times, give up, and just hope for the best. Skipping it feels like a small thing you're letting slide. It isn't. Every time your dog eats, a thin film starts forming on their teeth again, usually within hours. Left alone long enough, that film hardens into something much harder to deal with. And here's the part most people never connect. That hardened buildup doesn't just sit there looking bad. It works its way under the gum line, and every time your dog chews, a little bit of bacteria from that spot slips straight into their bloodstream. Where does that bacteria go? Straight toward the heart and the kidneys. Dental disease isn't really a teeth problem. It's one of the quieter ways a dog's health declines, and most owners never connect the dots because none of it looks dangerous from the outside. It just looks like bad breath. So brushing matters, and nothing fully replaces it. But there's a real gap between brushing is ideal and my dog will actually let me do it every day. And that gap is where most owners end up doing nothing at all. If you've already tried filling that gap, you've probably reached for one of three things. Dental chews are the obvious first move. They're treat-shaped, dogs love them, it feels like you're doing something. Here's what most people never check. Most chews only make contact with the very tips of the teeth. The disease starts at the gum line, which a chew barely touches, no matter how long your dog gnaws on it. Some brands also lean on starchy fillers to hold the chew together, and starch breaks down into exactly the kind of sugar plaque bacteria feed on. You can hand your dog a dental chew every single day and still be feeding the problem at the same time you're trying to fix it. Water additives are the second thing people try, since pouring a capful into the bowl feels almost effortless compared to brushing. Some of them genuinely help reduce bacteria, but on their own, without brushing or something else working alongside them, they're a mild assist, not a fix. And a few contain ingredients like added dyes or alcohol that aren't doing your dog any favors either. Then there's dog toothpaste, without the brushing, just letting your dog lick it off a spoon and calling it close enough. It isn't. The compounds in toothpaste work through direct mechanical contact with the tooth surface. Skip the brushing motion, and you're mostly just giving your dog a mint-flavored treat. None of these are scams. They're just partial. And partial is exactly why most owners feel like they're doing everything right and still end up at the vet with a dog who needs a real cleaning anyway. There's one category that actually closes that gap, and it's not a home remedy someone guessed at. It's an actual, clinically studied ingredient with the Veterinary Oral Health Council seal behind it, which is the same council board-certified veterinary dentists use to separate products that genuinely work from products that just claim to. Not every Plaque product carries that seal. Most don't. The ones that do had to prove it in controlled trials first. The ingredient is a specific North Atlantic seaweed called Ascophyllum nodosum, and unlike a toothpaste or a chew, it doesn't work by scrubbing anything. It works through your dog's saliva. When your dog eats this powder mixed into their food, the active compounds get absorbed and circulate through their system, eventually reaching the salivary glands. From there, it changes the composition of the saliva itself, making the surface of the teeth less hospitable for plaque to stick to in the first place. It's not scraping anything off. It's making the whole environment in your dog's mouth harder for plaque to build up on, every hour of the day, not just during a 10-second brushing session. In a controlled study where dogs were split into a treatment group and a placebo group after a professional cleaning, the ones getting this seaweed powder daily showed a 32% reduction in plaque and a 35% reduction in tartar after just 30 days, along with a 67% drop in gum bleeding. That's not a testimonial. That's a real trial with a placebo arm, which is exactly the kind of evidence most things marketed for your dog's teeth don't have behind them. Here's exactly how to use it, and getting this part right is what separates the dogs who see real results from the ones whose owners give up after 2 weeks. Look specifically for a product listing Ascophyllum nodosum, or AN-Prodin, as the ingredient, and check that it carries the VOHC seal of acceptance on the packaging. That seal is the difference between something that's been through real testing and something riding on the word natural alone. It comes as a powder you sprinkle over your dog's regular food once a day, based on their weight, right on the label. There's one ingredient that's non-negotiable to check for, and it's not really about this specific product, it's about anything that goes in your dog's mouth. Xylitol. It's sometimes listed as birch sugar or wood sugar on labels, and it shows up in human dental products more than people realize. It's genuinely toxic to dogs, not just less effective. Even a small amount can cause a dangerous drop in blood sugar. Most dental products made for dogs don't contain it, but check the label anyway, every time, especially if a product is marketed as multi-species or doesn't explicitly say it's formulated for pets. Past that one hard rule, the rest is about picking a version that's actually the studied ingredient, not just something in the same category. A lot of dental chews and powders on the shelf list kelp or seaweed vaguely, without naming Ascophyllum nodosum specifically, and without the VOHC seal anywhere on the packaging. Those aren't dangerous, they're just not the thing that was actually tested. You're paying for the word natural instead of the ingredient with real data behind it. The same goes for products padded out with added sugar or starchy fillers to make them more treat-like. Those ingredients can actually feed the same bacteria you're trying to control, working against the exact thing you bought the product for. One mistake ends this before it even starts working. Don't expect to see anything in the first few days and assume it's not doing anything. This works systemically, through their saliva, not through direct contact like a chew or a brush does. Most dogs show visible improvements somewhere between 3 and 8 weeks in, not overnight. If you stop after a week because nothing's changed yet, you're stopping right before it would have started showing. Start with a smaller amount than the label suggests for the first few days, especially if your dog is picky. Since the seaweed has a mild scent, some dogs need to adjust to. Mix it into whatever food they're already excited about. Most dogs take to it without issue. But if yours turns their nose up at first, don't switch to a bigger dose thinking more will help. Less, mixed into something they love, works better than more mixed into something they're already suspicious of. Get the dosing right, and most dogs adjust within a few days. But there's a real difference between plaque and tartar that's already hardened. And if you skip past it, you could be using this for months on a mouth it was never going to fix. This powder works on plaque and soft tartar buildup. It does not remove tartar that's already hardened into thick, dark, cemented buildup along the gum line. If you lift your dog's lip right now and see brown or gray chunks stuck solid to the base of the teeth, that's calculus, not plaque, and it's calcified the same way bone is. No powder, no chew, and no amount of brushing breaks that off safely. Trying to scrape it away yourself risks cracking a tooth or tearing the gum. That level of buildup needs a professional cleaning under anesthesia first, which resets your dog back to a clean baseline. This powder is what keeps them there afterward, not what gets them there from a bad starting point. There's one more thing worth knowing before you start. Because the active ingredient comes from seaweed, it naturally contains iodine. For the vast majority of dogs, this isn't an issue at all. But if your dog has a diagnosed thyroid condition, talk to your vet before adding it, since iodine can interact with thyroid treatment. Same goes for puppies still working through teething. Most of these products are tested and labeled for adult dogs, so check the label for a minimum age before starting. And if you're not sure, It's a quick question for your vet at their next puppy visit anyway. Put together, here's the actual plan. If your dog's teeth already have hard, visible tartar buildup, a professional cleaning comes first. No way around that one. Once their mouth is at a clean starting point, or if it's already reasonably clean and you just want to keep it that way without the daily fight, this is what stands between you and another appointment down the road. One scoop, once a day, in the food they already eat. No wrestling, no pinned and jaw, no cone of shame at the end of it. One more thing worth knowing, because bad breath doesn't always mean what people assume it means. If your dog's breath smells sour or musty, and it's been building up gradually alongside visible plaque along the gum line, that's exactly what this powder is built to address. But if the smell is sudden, sharp, or almost sweet and fruity, or if it's paired with excessive drinking, vomiting, or a noticeable drop in appetite, that's not a dental issue at all. That pattern points towards something metabolic, like kidney or liver function, and no dental product touches that. And if you notice the odor is coming from one specific tooth rather than their mouth generally, especially paired with them favoring one side when they chew, that's often an abscess or a broken tooth underneath, which needs a vet exam, not a supplement. Dental plaque causes a fairly even, gradual smell across the whole mouth. Anything sudden, one-sided, or paired with other symptoms is your sign to look past the teeth entirely. Your dog's next dental cleaning shouldn't have to be the wake-up call. If they've been avoiding the toothbrush and you've been avoiding the fight, this closes that gap starting tonight. Subscribe and turn on notifications so you catch the next one before the next problem shows up. And tell us in the comments, has your dog ever let you actually brush their teeth, or is it a fight every single time? We read every comment, and we want to know what's actually worked for people out there.